Okay, so the next skill that I'm going to perform for you guys is bedpan, okay? Now, with bedpan, it's just going to be the exact same way as far as knocking in and talking to your patient. Sometimes, okay, the evaluators may have the head of the bed up or down, okay, already. You just want to make sure that your patient is flat before you start putting things underneath them, like the chuck and the bedpan. So if the head of the bed is up, after you're done washing your hands, make sure that you touch the controller and put the head of the bed down, okay? So here we go. Knock, knock, knock. Good morning, Mrs. Jones. How are we doing today? Hi. All right. My name is Michael. I'm going to be your CNA today. And understand that you need to use the restroom today, all right? Yeah. So we're going to have to put you on a bedpan. So let me go ahead and first close your curtain for privacy. Okay? I'm then going to wash my hands. Okay? Now the patient's head of the bed is up, so I want to make sure that I find the controls and put the head of the bed down. Okay, now you want to make sure that, again, your patient is fully flat, okay, before you perform any of the things that you need to for this skill. Okay, so I'm going to get my gloves, okay, and what you're going to do first is you're going to put the chuck underneath your patient, okay, by first bending the patient's knees and then asking the patient to bridge their hips. Okay, so I'm going to go ahead and grab my chuck. Now first I'm going to go ahead and bend my patient's knees. Okay, so on the count of 3, 1, 2, 3. All right. And now I'm going to roll up the chuck. Okay, now if you roll it with the cotton facing you, it's easier. Okay, I like to roll it up about halfway. This just makes it easier so when your patient bridges and lifts their hips, you can just slide this right underneath and at least you know that it got all the way through, hopefully. Okay, so here we go. On the count of 3, Mrs. Jones, I'm just going to have you bridge your hips for me, okay? So 1, 2, and 3. Make sure you get underneath your patient. You can come down now. Okay. And make sure that it got to the other side. And these chucks measure end to end, so it should be able just to go right to the other side. Okay, you want to make sure it gets to the other side of the bed. Okay. Next is your bedpan. Okay. Now for the test, they're going to have 2 different types of bedpans. Okay. This is the fracture pan, the smaller one. You will not be using that one. You're just going to use the regular bedpan, okay? Now, this flat part right here is what's going to go onto the back, okay? So just like if the patient was sitting on a toilet, this would be in the front, okay? So again, with the patient's knees bent, okay? You're now going to ask them to bridge for a second time. Alrighty. So here we go on the count of 3, 1, 2, and 3. We'll bridge up, and then you're going to place the bedpan underneath. You can come down. Okay. Now it is always good to check and make sure that you have it in the right area, okay, because it could be not centered on your patient. Okay. So you just want to make sure and look. Okay, that looks pretty good. All right. So next, I'm going to go ahead and put the patient upright. Okay, you have to put them in a position that they're going to be fairly comfortable to have a bowel movement. Now, this is going to be at about a 45 to 60 degree angle. Okay, and this just helps the patient have a bowel movement. Okay. You're now going to give them toilet tissue and wipes. And you're also going to give them the call light. The way that you're going to perform this skill is now you're going to take off your gloves and act like you're leaving the room. Now, you're not really going to leave the room, but you have to act like you are. So, taking the gloves off, okay, from the palm, you're going to go downward towards the floor. It turns the first one inside out. The second one is going to eat up that first one, and 2 fingers going to turn that second glove from the wrist up and over. Okay? You're going to leave the curtain closed. Mrs. Jones, call me when you need me. Okay? So you're now going to leave. All right? You will then come back into the room pretty much immediately. Allow the evaluator to tell you to come back in. So you come back in. Okay? You wash your hands. Make sure you perform hand hygiene. And then put on your second pair of gloves. So this particular skill here is a 2-glove skill. Or a 2 sets of gloves, I should say. Okay, you want to make sure that you put that second pair of gloves on, because now you're going to take everything away from your patient, so that way you can complete the skill. Okay, so everything that you gave to your patient, you will now take away. Okay, so I'll take the call bell. Alright, you're going to take the toilet tissue and the wipes. You're going to place them back in their appropriate areas of where you got them from. Okay, next, in order to do anything with your patient, you have to have your patient lying flat. So we're going to find the controls, put your patient flat. And then we're going to take the bedpan out along with the chuck. So there's 3 hip raises or bridges in this skill, okay? So you're going to go ahead and create your window, have your patient's knees bent, okay? And at the same time, with the bedpan and the chuck, you're going to just pull the bedpan out and wrap it over the top. So Ms. Jones, we're going to have you bridge on the count of 3. 1, 2, and 3. And you're going to wrap your chuck over the bedpan. Okay? So we are now going to discard the contents of the bedpan. So go ahead and take your chuck. This will then be discarded in the trash. Okay? Now you have to make sure that the contents of this bedpan goes into the toilet. Okay? So you're going to dump it in the toilet, and then you will rinse the contents 3 times into the toilet. Make sure that you're dumping it into the toilet, okay? So this is 1, this is 2, and this is 3, okay? Flush the toilet. I'm then going to get a paper towel, several paper towels, and dry out the bedpan, okay? Go ahead and put the bedpan back. Okay. Next, go ahead and take your gloves off. So again, pull from the palms down to the floor. That second glove gets eaten up by the second glove. And then from the wrist, up and over. Okay, so you've now taken your second pair off. Alrighty, Mrs. Jones, is there anything else I can get you, like a magazine or anything?
No, I'm good.
Okay, great. Call me if you need anything. Alright, you are then going to open the curtain, perform hand hygiene, tell the evaluator that this skill is now done.